RN Prometric exam collection. Questions 21 to 40. Part 2. 21. A client with atrial fibrillation who is receiving maintenance therapy of warfarin sodium, Coumadin, has a prothrombin time, PT, of 35 seconds. Based on the prothrombin time, the nurse anticipates which of the following prescriptions? 1. Adding a dose of heparin sodium. 2. Holding the next dose of warfarin. 3. Increasing the next dose of warfarin. 4. Administering the next dose of warfarin. The answer is 2. Holding the next dose of warfarin. Rationale: the normal PT is 9.6 to 11.8 seconds, male adult, or 9.5 to 11.3 seconds, female adult. A therapeutic PT level is 1.5 to 2 times higher than the normal level. Because the value of 35 seconds is high, and perhaps near the critical range, the nurse should anticipate that the client would not receive further doses at this time. Therefore, the prescriptions noted in options 1, 3, and 4 are incorrect. 22. The nurse checks the laboratory result for a serum digoxin level that was prescribed for a client earlier in the day and notes that the result is 2.4 nanograms per milliliter. The nurse should take which immediate action? 1. Notify the physician. 2. Check the client's last pulse rate. 3. Record the normal value on the client's flow sheet. 4. Administer the next dose of the medication as scheduled. The answer is 1. Notify the physician. Rationale: the normal therapeutic range for digoxin is 0.5 to 2 nanograms per milliliter. A level of 2.4 nanograms per milliliter exceeds the therapeutic range and indicates toxicity. The nurse should notify the physician, who may give further prescriptions about holding further doses of digoxin. Option 3 is incorrect because the level is not normal. The next dose should not be administered because the serum digoxin level exceeds the therapeutic range. Checking the client's last pulse rate may have limited value in this situation. Depending on the time that has elapsed since the last assessment, a current assessment of the client's status may be more useful. 23. A client has been admitted to the hospital for urinary tract infection and dehydration. The nurse determines that the client has received adequate volume replacement if the blood urea nitrogen level drops to 1. 3 mg per deciliter. 2. 15 mg per deciliter. 3. 29 mg per deciliter. 4. 35 mg per deciliter. The answer is 2. 15 mg per deciliter. Rationale: the normal blood urea nitrogen level is 8 to 25 mg per deciliter. Values such as those in options 3 and 4 reflect continued dehydration. Option 1 reflects a lower than normal value, which may occur with fluid volume overload, among other conditions. 24. A client with a history of gastrointestinal bleeding has a platelet count of 300,000 cells/mm3. The nurse should take which action after seeing the laboratory results? 1. Report the abnormally low count. 2. Report the abnormally high count. 3. Place the client on bleeding precautions. 4. Place the normal report in the client's medical record. The answer is 4. Place the normal report in the client's medical record. Rationale: a normal platelet count ranges from 150,000 to 400,000 cells/mm3. The nurse should place the report containing the normal laboratory value in the client's medical record. A platelet count of 300,000 cells/mm3 is not an elevated count. The count also is not low, therefore bleeding precautions are not needed. 25. An adult client with cirrhosis has been following a diet with optimal amounts of protein because neither an excess nor a deficiency of protein has been helpful. The nurse evaluates the client's status as being most satisfactory if the total protein level is: which of the following values? 1. 0.4 g/dl. 2. 3.7 g/dl. 3. 6.4 g/dl. 4. 9.8 g/dl. The answer is 3. 6.4 g/dl. Rationale: the normal range for total serum protein level in the adult client is 6 to 8 g/dl. The client with cirrhosis often has low total protein levels as a result of inadequate nutrition. Excess protein is not helpful, though, because a function of the liver is to metabolize protein. A diseased liver may not metabolize protein well. Options 1 and 2 identify low values, and option 4 identifies a high protein value. 26. A client with diabetes mellitus has a glycosylated hemoglobin A1C level of 9%. Based on this test result, the nurse plans to teach the client about the need to 1. Avoid infection. 2. Take in adequate fluids. 3. Prevent and recognize hypoglycemia. 4. Prevent and recognize hyperglycemia. The answer is 4. Prevent and recognize hyperglycemia. Rationale: in the test result for glycosylated hemoglobin A1C, 7% or less indicates good control, 7% to 8% indicates fair control, and 8% or higher indicates poor control. This test measures the amount of glucose that has become permanently bound to the red blood cells from circulating glucose. Elevations in the blood glucose level will cause elevations in the amount of glycosylation. Thus the test is useful in identifying clients who have periods of hyperglycemia that are undetected in other ways. Elevations indicate continued need for teaching related to the prevention of hyperglycemic episodes. 27. The nurse is caring for a client with a diagnosis of cancer who is immunosuppressed. The nurse would consider implementing neutropenic precautions if the client's white blood cell count was which of the following? 1. 2,000 cells/mm3. 2. 5,800 cells/mm3. 3. 8,400 cells/mm3. 4. 11,500 cells/mm3. The answer is 1. 2,000 cells/mm3. Rationale: the normal white blood cell count ranges from 4,500 to 11,000/mm3. The client who has a decrease in the number of circulating white blood cells is immunosuppressed. The nurse implements neutropenic precautions when the client's values fall sufficiently below the normal level. The specific value for implementing neutropenic precautions usually is determined by agency policy. Options 2, 3, and 4 are normal values. 28. A client brought to the emergency department states that he has accidentally been taking 2 times his prescribed dose of warfarin, Coumadin, for the past week. After noting that the client has no evidence of obvious bleeding, the nurse plans to do which of the following? 1. Prepare to administer an antidote. 2. Draw a sample for type and crossmatch and transfuse the client. 3. Draw a sample for an activated partial thromboplastin time, APTT, level. 4. Draw a sample for prothrombin time, PT, and international normalized ratio, INR. The answer is 4. Draw a sample for prothrombin time, PT, and international normalized ratio, INR. Rationale: the next action is to draw a sample for PT and INR level to determine the client's anticoagulation status and risk for bleeding. These results will provide information as to how to best treat this client, example, if an antidote such as vitamin K or a blood transfusion is needed. The APTT monitors the effects of heparin therapy. 29. The nurse is assigned to a 40-year-old client who has a diagnosis of chronic pancreatitis. The nurse anticipates the client's serum amylase level to be which of the following? 1. 45 units/L. 2. 100 units/L. 3. 300 units/L. 4. 500 units/L. The answer is 3. 300 units/L. Rationale: the normal serum amylase level is 25 to 151 units/L. With chronic cases of pancreatitis, the rise in serum amylase levels usually does not exceed 3 times the normal value. In acute pancreatitis, the value may exceed 5 times the normal value. Options 1 and 2 are within normal limits. Option 4 is an extremely elevated level seen in acute pancreatitis. 30. A nurse is planning to teach a client with malabsorption syndrome about the necessity of following a low-fat diet. The nurse develops a list of high-fat foods to avoid and includes which food item on the list? 1. Oranges. 2. Broccoli. 3. Cream cheese. 4. Broiled haddock. The answer is 3. Cream cheese. Rationale: fruits and vegetables tend to be lower in fat because they do not come from animal sources. Broiled haddock is also naturally lower in fat. Cream cheese is a high-fat food. 31. The nurse instructs a client with renal failure who is receiving hemodialysis about dietary modifications. The nurse determines that the client understands these dietary modifications if the client selects which items from the dietary menu? 1. Cream of wheat, blueberries, coffee. 2. Sausage and eggs, banana, orange juice. 3. Bacon, cantaloupe melon, tomato juice. 4. Cured pork, grits, strawberries, orange juice. The answer is 1. Cream of wheat, blueberries, coffee. Rationale: the diet for a client with renal failure who is receiving hemodialysis should include controlled amounts of sodium, phosphorus, calcium, potassium, and fluids. The food items in options 2. 32. A client with hypertension has been told to maintain a diet low in sodium. A nurse who is teaching this client about foods that are allowed includes which food item in a list provided to the client? 1. Tomato soup. 2. Boiled shrimp. 3. Instant oatmeal. 4. Summer squash. The answer is 4. Summer squash. Rationale: foods that are lower in sodium include fruits and vegetables, option 4, because they do not contain physiological saline. Highly processed or refined foods, options 1 and 3, are higher in sodium unless their food labels specifically state low sodium. Saltwater fish and shellfish are high in sodium. 33. A nurse is caring for a client with cirrhosis of the liver. To minimize the effects of the disorder, the nurse teaches the client about foods that are high in thiamine. The nurse determines that the client has the best understanding of the dietary measures to follow. If the client states an intention to increase the intake of 1. Pork. 2. Milk. 3. Chicken. 4. Broccoli. The answer is 1. Pork. Rationale: the client with cirrhosis needs to consume foods high in thiamine. Thiamine is present in a variety of foods of plant and animal origin. Pork products are especially rich in this vitamin. Other good food sources include nuts, whole grain cereals, and legumes. Milk contains vitamins A, D, and B2. Poultry contains niacin. Broccoli contains vitamin C, E, and K and folic acid. 34. The nurse is instructing a client with hypertension on the importance of choosing foods low in sodium. The nurse should teach the client to limit which of the following foods? 1. Apples. 2. Bananas. 3. Smoked sausage. 4. Steamed vegetables. The answer is 3. Smoked sausage. Rationale: smoked foods are high in sodium. Options 1, 2, and 4 are fruits and vegetables that are low in sodium. 35. A client who is recovering from surgery has been advanced from a clear liquid diet to a full liquid diet. The client is looking forward to the diet change because he has been bored with the clear liquid diet. The nurse would offer which full liquid item to the client? 1. Tea. 2. Gelatin. 3. Custard. 4. Popsicle. The answer is 3. Custard. Rationale: full liquid food items include items such as plain ice cream, sherbet, breakfast drinks, milk, pudding and custard, soups that are strained, refined cooked cereals, and strained vegetable juices. A clear liquid diet consists of foods that are relatively transparent. The food items in options 1, 2, and 4 are clear liquids. 36. A client is being weaned from parenteral nutrition, PN, and is expected to begin taking solid food today. The ongoing solution rate has been 100 milliliters per hour. A nurse anticipates that which of the following prescriptions regarding the PN solution will accompany the diet order? 1. Discontinue the PN. 2. Decrease PN rate to 50 milliliters per hour. 3. Start 0.9% normal saline at 25 milliliters per hour. 4. Continue current infusion rate orders for PN. The answer is 2. Decrease PN rate to 50 milliliters per hour. Rationale: when a client begins eating a regular diet after a period of receiving PN, the PN is decreased gradually. PN that is discontinued abruptly can cause hypoglycemia. Clients often have anorexia after being without food for some time, and the digestive tract also is not used to producing the digestive enzymes that will be needed. Gradually decreasing the infusion rate allows the client to remain adequately nourished during the transition to a normal diet and prevents the occurrence of hypoglycemia. Even before clients are started on a solid diet, they are given clear liquids followed by full liquids to further ease the transition. A solution of normal saline does not provide the glucose needed during the transition of discontinuing the PN and could cause the client to experience hypoglycemia. 37. A nurse is preparing to change the parenteral nutrition, PN, solution bag and tubing. The client's central venous line is located in the right subclavian vein. The nurse asks the client to take which essential action during the tubing change? 1. Breathe normally. 2. Turn the head to the right. 3. Exhale slowly and evenly. 4. Take a deep breath, hold it, and bear down. The answer is 4. Take a deep breath, hold it, and bear down. Rationale: the client should be asked to perform the Valsalva maneuver during tubing changes. This helps avoid air embolism during tubing changes. The nurse asks the client to take a deep breath, hold it, and bear down. If the intravenous line is on the right, the client turns his or her head to the left. This position increases intrathoracic pressure. Options 1 and 3 are inappropriate and could cause the potential for an air embolism during the tubing change. 38. A client with parenteral nutrition, PN, infusing has disconnected the tubing from the central line catheter. A nurse assesses the client and suspects an air embolism. The nurse should immediately place the client in which position? 1. On the left side, with the head lower than the feet. 2. On the left side, with the head higher than the feet. 3. On the right side, with the head lower than the feet. 4. On the right side, with the head higher than the feet. The answer is 1. On the left side, with the head lower than the feet. Rationale: air embolism occurs when air enters the catheter system, such as when the system is opened for intravenous, 4, tubing changes or when the 4 tubing disconnects. Air embolism is a critical situation. If it is suspected, the client should be placed in a left side lying position. The head should be lower than the feet. This position is used to minimize the effect of the air traveling as a bolus to the lungs by trapping it in the right side of the heart. Options 2, 3, and 4 are incorrect positions if an air embolism is suspected. 39. A nurse is changing the central line dressing of a client receiving parenteral nutrition, PN, and notes that the catheter insertion site appears reddened. The nurse next assesses which of the following items? 1. Client's temperature. 2. Expiration date on the bag. 3. Time of last dressing change. 4. Tightness of tubing connections. The answer is 1. Client's temperature. Rationale: redness at the catheter insertion site is a possible indication of infection. The nurse would next assess for other signs of infection. Of the options given, the temperature is the next item to assess. The tightness of tubing connections should be assessed each time the PN is checked. Loose connections would result in leakage, not skin redness. The expiration date on the bag is a viable option, but this also should be checked at the time the solution is hung and with each shift change. The time of the last dressing change should be checked with each shift change. 40. A nurse is preparing to hang fat emulsion, lipids, and notes that fat globules are visible at the top of the solution. The nurse takes which of the following actions? 1. Rolls the bottle of solution gently. 2. Obtains a different bottle of solution. 3. Shakes the bottle of solution vigorously. 4. Runs the bottle of solution under warm water. The answer is 2. Obtains a different bottle of solution. Rationale: fat emulsion, lipids, is a white, opaque solution administered intravenously during parenteral nutrition therapy to prevent fatty acid deficiency. The nurse should examine the bottle of fat emulsion for separation of emulsion into layers or fat globules or for the accumulation of froth. The nurse should not hang a fat emulsion if any of these are observed and should return the solution to the pharmacy. Therefore, options 1, 3, and 4 are inappropriate actions.